If you take blood pressure medication, what you're about to hear could completely change the way you use it every single day. Because here's something most people never realize. It's not just what medication you take that matters, it's when you take it. And a simple timing mistake, something millions of patients do without thinking, could be silently reducing the effectiveness of your treatment, or even leaving your heart and kidneys exposed at the worst possible time of day. In fact, I've seen this exact issue repeated week after week in patients who were doing everything right, yet still struggling with unstable blood pressure, dizziness, or unexpected complications. Today, Dr. Mandell is going to break down the most dangerous timing mistakes with blood pressure medications. Mistakes that most doctors never fully explain in a short appointment, but that can make a real difference in your long-term health. Stay with me, because one of these mistakes is so common, most people don't even realize they're doing it until it becomes a serious problem. If you take your blood pressure medication with your morning coffee, you need to stop what you're doing and watch this. If you take your water pill after 2 p.m., the same warning applies. And if you've ever doubled up on your dose after missing one, I need to talk to you. What I'm about to explain is something your pharmacist should have told you the day you filled your prescription. This is about the most dangerous timing mistakes in blood pressure medication use. Thousands of patients take blood pressure medication every single day, and yet there is one timing mistake I see repeatedly every week, something most doctors never properly address during a short 10 to 15-minute appointment. If you take your blood pressure medication in the morning or at night without understanding these specific timing rules, you may be reducing its effectiveness by half. Or worse, you may be creating a dangerous window where your heart and kidneys are left underprotected. What I'm sharing with you now is the same guidance I give my own patients after the prescription is already written, the conversation that rarely happens in the exam room. Stay with me, because timing mistake number 3 is the one that surprises people the most. I'm Dr. Mandell. I created this channel because the information that protects lives inside my clinic should not stay inside my clinic. Blood pressure medication is one of the most commonly prescribed drug classes in the United States. Most patients are told what to take, but not when to take it, what to combine it with, or what to avoid. That missing information is quietly affecting people's health more than most realize. Today, I'm going to walk you through the 5 most dangerous timing mistakes with blood pressure medication. Mistakes that can increase cardiovascular risk, reduce drug effectiveness, and sometimes even trigger serious complications. And I'll also tell you exactly what you should ask your doctor or pharmacist before your next dose. If this kind of clear, honest medical information is what you want, consider subscribing. I publish one in-depth video every week focused exactly on this kind of real-world health guidance. Let's start with one of the most commonly prescribed groups of medications, ACE inhibitors and ARBs. Drugs like lisinopril, ramipril, losartan, and valsartan are prescribed to millions of people every day. For decades, the standard instruction was simple: take once daily in the morning. But that instruction was largely based on convention, not necessarily on strong evidence. Recent research suggests something interesting. Patients who take their blood pressure medication at bedtime may experience better cardiovascular outcomes compared to those who take it in the morning. We're talking about lower risk of heart attack, lower risk of stroke, and in some studies, even lower cardiovascular mortality. Why does this happen? Because blood pressure follows a natural daily rhythm. It drops during sleep, then rises sharply in the early morning hours, a phenomenon known as the morning surge. And that morning surge is exactly when heart attacks and strokes are most likely to occur. A medication taken at bedtime is still active during that vulnerable early morning window. But a medication taken in the morning may already be wearing off by then. This isn't a minor detail. It can have clinically meaningful effects. However, I want to be honest with you. The science is still evolving. Some studies show clear benefits of bedtime dosing, while others show little or no difference. The correct timing depends on your specific medication and your individual blood pressure pattern. What I tell my patients is simple. Ask your prescribing physician, should I be taking this at bedtime instead of in the morning? That one question alone can open a much more personalized approach to your treatment. If your doctor can explain why morning or bedtime is better for your case, that's ideal. But if they've never considered it before, that also tells you something important. Now let's move to something that surprises people every single time. I've had patients doing this daily without any idea it was a problem. Grapefruit and grapefruit juice contain compounds called furanocoumarins. These compounds block an important enzyme in your digestive system called CYP3A4. That enzyme is responsible for breaking down many blood pressure medications, especially calcium channel blockers such as felodipine, nifedipine, and amlodipine. When this enzyme is blocked, the medication is not processed normally. As a result, blood levels of the drug can rise significantly, sometimes to dangerous levels. This can lead to an excessive drop in blood pressure, dizziness, fainting, and in some cases, dangerous heart rhythm disturbances. What makes this even more important is the duration of the effect. Grapefruit can interfere with this enzyme for up to 24 to 72 hours after consumption. That means it's not just about the moment you eat or drink it. A glass of grapefruit juice at night can still affect your medication the next day. If you are taking any calcium channel blocker, you should directly ask your pharmacist, is grapefruit a concern with this specific medication? Do not assume it is safe. Always confirm. Now we move to timing mistake number 3, and this is the one that surprises people the most because it is not about food or drug interactions. It's about something much simpler, but just as important. Diuretics, also known as water pills, are among the most commonly used medications for blood pressure control. Drugs like hydrochlorothiazide, furosemide, and chlorthalidone work by helping the kidneys remove excess fluid from the body, reducing blood volume and lowering pressure. The timing problem is very common. Many patients take their diuretic in the late afternoon or even in the evening. Sometimes this happens because they forgot their morning dose. Other times because they were never given clear timing instructions. But when a diuretic is taken too late in the day, the result is predictable: frequent nighttime urination. Most people accept this as normal, but it is not normal. It is a preventable side effect caused by incorrect timing. And here is what I want you to understand about why this matters beyond just sleep disruption. Every time an older adult gets out of bed in the middle of the night in the dark, sometimes disoriented, and with blood pressure that can shift suddenly upon standing, the risk of a fall increases significantly. Nighttime falls in older adults are one of the leading causes of hip fractures, and hip fractures in patients over the age of 70 carry a one-year mortality rate of 20 to 30%. That is the real-world consequence of taking your diuretic at 6 in the evening instead of 8 in the morning. The rule I give every patient is simple. If you are on a diuretic, take it in the morning, ideally before 10 a.m., so that the peak effect occurs during the day, not during the night. If you are prescribed a twice-daily diuretic, the second dose should never be taken later than 2 p.m. Now let's move to another extremely common class of medications: beta blockers. Medications such as metoprolol, atenolol, carvedilol, and propranolol are widely prescribed for blood pressure control and heart conditions. Most patients take them in the morning, and many of those same patients also drink their morning coffee at the same time or shortly after. Here is what is happening inside your body when that combination occurs. Caffeine is a stimulant. It activates your sympathetic nervous system, increasing heart rate and temporarily raising blood pressure. Beta blockers do the opposite. They block that sympathetic activation, slow the heart rate, and reduce the force of heart contractions. So when you take a beta blocker at the same time as a significant amount of caffeine, it is almost like pressing the gas pedal and the brake at the same time. In most people, the medication effect dominates. But in patients with certain cardiac arrhythmias, this combination can lead to palpitations or irregular heartbeats during the peak caffeine window, usually 30 to 60 minutes after consumption. There is also evidence that caffeine may influence how certain beta blockers are metabolized, particularly metoprolol, in individuals with specific genetic variations affecting drug processing enzymes. My recommendation is straightforward. If you are taking a beta blocker for blood pressure or a heart condition, try to wait at least 30 to 45 minutes between taking your medication and drinking coffee. It is a small adjustment, but for patients with a history of arrhythmias, it can be clinically meaningful. This is one of the most frequent timing mistakes I see, and its impact varies greatly depending on the exact medication and the individual patient. Now, let's talk about another very dangerous pattern I see in real clinical practice. A patient misses their morning blood pressure medication. They remember later in the day, at noon or 3 p.m. or even at dinner time. The instinct is almost always the same. I'll just take 2 tonight to make up for it. For some medications, this may not cause major harm, but for others, especially calcium channel blockers, certain ARBs, and beta blockers, doubling the dose can lead to a sudden and significant drop in blood pressure. This can cause dizziness, fainting, and in older adults with reduced vascular stability, even dangerous falls. There is another variation of this problem that is just as concerning. Some patients who are prescribed twice-daily medications quietly switch to once-daily use because it is easier to remember, often without telling their physician. Their blood pressure readings may still look acceptable, so the reduced dosing is never corrected. But the reality is that their cardiovascular protection is incomplete. The standard guidance is this: if you miss a dose and it is still the same day, take it as soon as you remember. However, if it is close to your next scheduled dose, skip the missed one and continue your regular schedule. Never double up without first consulting your physician or pharmacist, because the correct answer depends entirely on the specific medication you are taking. Before we finish, I want to make something very clear. Blood pressure medication saves lives. The evidence supporting treatment of hypertension is among the strongest in all of cardiovascular medicine. I am not telling you to stop your medication. I am not telling you your doctor made a mistake. What I am telling you is that the conversation about timing, when to take it, what to take it with, and what to do if you miss a dose, is often missing from a typical short medical appointment. And that gap in understanding can have real consequences. If you are over 60 and taking blood pressure medication, or if someone you care about is, here are 5 important questions to ask at your next appointment. First, should I take my medication in the morning or at bedtime? Second, are there any foods, supplements, or drinks I should avoid around my dose? Third, what should I do if I miss a dose? Fourth, is there a specific time of day when my blood pressure is highest? And fifth, are there any timing interactions with my other medications? These 5 questions, asked clearly, can do more for your cardiovascular safety than almost anything you hear in a video, because your physician has your full medical history, which I do not. But I can give you the questions that open that conversation. If this information helped you, something you did not hear clearly in your last appointment, share it with someone you care about who is managing blood pressure. And subscribe, because every week I will continue sharing the kind of clinical insights that patients often never hear until it is too late. I'm Dr. Mandell, and I'll see you in the next video.